Hello, I'm Dr. Brandt Gibson, and today I want to talk to you about venous ulcers. So yesterday we talked about pressure ulcers. Venous ulcers are very similar in fact that they are wounds to the legs, but they are caused typically by a blood circulation problem. So let me talk about venous stasis a little bit first. So venous stasis is basically the pooling of blood in the extremities, typically in the legs and feet. The cause is the failure of the veins getting the blood back to the heart. So the way the body's designed, the veins are designed like a ladder where they have valves going all the way up. And at every level, when the heart pumps, it pumps blood to the feet or to the extremities, and then the blood flows back through the veins and then stops at the valve as it's going up. Then it goes up the next heartbeat, it goes up to the next valve and stops, and as it's going up, it's getting back to the heart. In individuals where this is failing, they'll get leaking of those valves and you get pooling in the legs. You can get edema or swelling in the legs, or you can get varicose veins where the body creates other vessels to try to get the blood back to the heart another way. And in all cases, what's happening is as you're getting it pooling in the legs, a lot of times you will get the blood to seep out into the tissues, and you start to get deposits in the skin that will discolor the skin. So a lot of times you're going to have a brown discoloration or a darkening of the skin, and a simple wound in this skin that becomes more thin because of the swelling and edema in the area can create an ulcer. So you can actually get a wound where the fluid, because it can't get back to the heart, starts to seep out of the skin and it becomes a wound. This is very common. Most common location, of course, would be around the ankle area, and it's really just a problem of the blood pooling in that area. So about 1% of Americans have venous skin ulcers. So it's a small percentage, but the problem with these venous skin ulcers is it takes a very, very long time to heal, often 6 months to a year, just because they kind of stay there because the venous stasis continues. So you kind of have to treat the venous stasis to get rid of the venous stasis ulceration. Now, the problem with that is if you get an infection secondarily to that venous stasis wound, then the wound gets worse because of the bacterial growth in it, and the pain will increase typically as well. So you get more pain and so forth. So what are the typical symptoms of a venous stasis ulceration? Number one, you get a wound in a swollen, discolored extremity. You can sometimes get you can get a dry rash or dry skin to the area. You'll get a foul-smelling ooze that's coming out of it. So basically you got seeping out because the fluid's trying to get away from the extremities, and so it's seeping out through the skin, and that's what you start to smell and start to get. And so they're very, very wet wounds, and they're always draining, and a lot of times they will just almost drip off the wound in that case. So the problem with that is treatment is relatively difficult if you don't do something to stop the venous stasis. So one is you're going to be told that you should be raising your legs, and you should be doing it multiple times a day, 3 to 4 times a day, where you're getting your legs higher than your heart so that the fluid can actually flow with help of gravity back to the heart, and it gets the swelling out of the legs. A lot of times we will wrap these wounds in such a way to get the flow out of there. Compression stockings is another way, though typically with a wound, we don't use the compression stockings, but we use a compressive type wrap to push the fluid from the outer layers to the deeper vessels where it has an easier time getting back to the heart. So when are you at a risk? So you say, okay, I know I have some venous stasis, I do have some swelling. Am I at high risk for having these? If you've had previous injuries to the legs, that increases the chance of that area becoming a wound. If you have pretty significant varicose veins, that increases your chance of having enough pooling in the area to create a wound. If you smoke, the smoking actually can similarly increase your chance of getting a venous stasis ulceration. And if you're obese or overweight, this also, because of the increased size, also increases the chance of your body having a hard time getting the blood back to the heart. And so it increases your chance of a venous stasis type injury. That being said, there are also some things you can do to prevent both the venous stasis and the ulceration from this venous stasis disease. One, if you're a smoker, quit. Lose weight. If you're obese, losing weight actually decreases the retrograde pressure on the veins and allows the blood to get back to the heart. You need to control disease processes that can increase this, like diabetes or high blood pressure. A lot of times they will have you treat blood clots, like doing a simple aspirin can actually decrease that. Reducing the salt in your diet. So you're reducing salt, which is a lot of times going to decrease the amount of swelling that you're getting in the extremities. Exercise is probably one of the most effective ways to treat venous stasis, because as you exercise more, you're pumping the blood back to the heart. And of course, compression stockings that we talked about, anything that compresses to keep the venous stasis, keep the edema and swelling and pooling in the extremities from getting severe, will also help prevent the wounds. So venous stasis ulceration, it is very important that you treat venous stasis to prevent these ulcerations, because they're very hard to heal after the fact. This is Dr. Brandt Gibson, and this is your Podiatry Tip Day 46, venous stasis ulcerations. My recommendation is, if you have a varicose veins, if you have a problem with swelling of your legs, that you do something to decrease that swelling, whether it's exercise, compression stockings, decreasing your blood pressure, controlling your diabetes, losing weight, whatever the big contributing factors are. If you eliminate those, you can prevent having a venous stasis ulceration and ultimately